It seems to me the health data supply chain is a different concept, and what it gives you is agility. And one of the things we just came through with the pandemic is that we recognize the need for agility at a pace we've never had to experience in healthcare, at least in my lifetime, where we didn't know what the problem was until the problem presented itself. And then it was sort of almost like the demand generated the need, and then we had to figure out how to respond to it. And the health data supply chain seems to me to be a better way of not spending as much time normalizing the data and spending more time actually generating benefit for the organization. Michael, does that capture it? And how does it do that?
Well, yeah, I think that captures the essence. And I think what we're trying to turn on its head is, and COVID is a great example. And we have a great story about how we partnered on that rapid response. March of 2020, when there was the beginnings of shutdowns and stay-at-home orders and all of the changes that have become part of normal life over the last 18 months, the conversation that Dave and I and a bunch of other folks had was, how do we figure out who are the patients who are most likely to die from this disease that we know very little about? And where the health data supply chain came in is we said, well, hold on. Arcadia has a reference data set. It's about 150 million persons that we've collected. We do a bunch of research on it. And we have customers in Boston, New York, and Seattle, three of the earliest outbreak centers in the United States. This was a time where testing was widely unavailable. You had some skunkworks testing projects going on in different cities. But what we did have was diagnosis data coming in from ADTs or from EHRs. And so we were able to build a little machine learning model. And I say that, and it's not anything fancy. It was pretty simple at the time to say, what symptoms are we seeing that tie to what the CDC is reporting we should be watching for, that tie to the limited number of positive tests that we have, so we can then back into a registry of risk factors. And everyone at the beginning of the pandemic said, hey, it seems that folks who are overweight or folks with multiple chronic conditions, elderly, are more susceptible to complications from COVID. But that was just a hunch. And so we were able to build these models, get them in the hands of Dave's care traffic control team, and really rapidly spin up an outreach program to those patients. And Dave can talk about the outreach program. But what was great about the supply chain was, like any traditional supply chain, there's always an effort of supply chain optimization. We were able to take feedback from their calls and use it as an input to the model to help the model get smarter. So as we continued to build these risk strata and cohorts, they were getting smarter and more refined each time. And I think Dave can speak to some of the great findings and some of the great support that Castell and Intermountain were able to provide to their patients through these efforts.